Welcome back to Fox 8 News in the morning. We continue to learn new information about the coronavirus, its symptoms and lasting effects with more. We're bringing in Dr. Ray Dwake. And Doctor, thank you first for being here. We want to talk about what you're seeing. You're on the front lines firsthand of what the virus is doing to the lungs. Talk about that. And even with survivors, I mean, they really have a long recovery ahead for them.
Yes, so clearly some of these patients get very sick, needing to be in the intensive care unit. And they, when they are in intensive care unit, they spend quite a bit of time there, sometimes needing mechanical ventilators, needing on a breathing machine. So that, whether it's COVID or other reasons, you get on the breathing machine for a while, that requires a long recovery afterwards because they have to be sedated, they have to be comforted when they're on these machines. So it takes a while once they recover. Some of them even take longer on these devices where they have to have a tracheostomy tube, which is a breathing machine through a hole in the neck moving forward. But those who do not need that and get extubated, they have a long path. Some of them have a long path to recovery because their bodies now have to recover. They have to go through rehabilitation. The lung function actually gets suffers a hit, so they have to be watched and monitored over time. So all of these things are seen in the aftermath of having a severe COVID infection.
When you talk about looking at the lungs, and if you were to see it on a CAT scan, does this compare anything like to pneumonia?
It is very similar. There are different types of pneumonias, but if you do a CAT scan or an X-ray on these patients, you will find what we call infiltrates, which are these hazy areas. You can see the normal lungs look black because they're full of air, but you see all these white spots, which indicate the inflammation and the infection that we see in these patients. And that takes a while to recover and definitely causes significant damage to the lungs.
This week we got an inside look at some video inside the ICU dealing with the virus. It was heartbreaking. It was eye-opening. What are you seeing in the COVID-19 unit?
Really what I've seen is teamwork. You know, our caregivers have stepped up and they're working together, whether they're doctors, advanced practice providers, nurses, respiratory therapists, and even the cleaning people. It's really a team of teams effort where everybody has stepped up and worked together to take care of these patients.
Now,
and the other thing,
go ahead, doctor.
And the other thing is the way to communicate with these patients to minimize, the interaction with them. You know, what we've seen in the media, how we use the doors, the glass doors of the isolation rooms to communicate with the patients.
That's what's hard because we were reporting even yesterday, you're trying to keep that equipment outside. So the less you go in, the better. But then you think about these patients, how they're suffering on their own. This is also interesting. The symptoms now really head to toe, but they're very strange. The list goes loss of sense of smell and taste, rashes, frostbite, pink eye, COVID toe. Can you explain what COVID toe is and why these side effects?
Yes, so just start off just to make sure that the most common symptoms are still fever, cough, and shortness of breath. However, more recently, we have starting to recognize all these things that you mentioned. COVID toe is really, it's almost like a frostbite, which indicates the involvement of the blood vessels in the small toes. We have not seen that much of it here. It's not very common. We've seen some in the hands of some patients. It's very similar, but it all indicates how this virus can affect many organs. It's not just the lungs. It can affect the skin. It can affect the blood vessels. It's just a diffuse infection that goes everywhere.
But it's not common, so I guess that's gives us a sigh of relief, doctor.
That's correct. Yeah.
Doctor, thank you so much for being with us. Again, you're on the front lines. Thanks for all the work you're doing, and stay safe.
Thank you for having me.
Thanks, doctor.